Cover those legs, KTS and recurring cellulitis. Klippel-Trenaunay syndrome is a very rare sporadic congenital disorder which is characterized by capillary and venous malformation and hypertrophy of soft tissues and overgrowth of bone. This can occasionally occur with lymphatic malformations. KTS is so rare that understanding the complications can potentially reduce morbidity and mortality. One of those complications is discussed in the case below. The case starts with a 32-year-old female with KTS who presented in septic shock after 3 days of headache, fever, and shortness of breath. Over the previous 2 years, she had a total of 4 admissions related to sepsis, 2 for cellulitis of the right lower extremity and 2 for episodes of unexplained bacteremia from Pasteurella and Acinetobacter. Her exam was significant for large abdomen with pitting edema, chronic skin changes, hypertrophy, and right lower extremity lymphedema consistent with KTS. She is treated for septic shock in the ICU, and blood cultures returned positive for Acinetobacter. In conclusion, Pasteurella and Acinetobacter are common pathogens in the nose and mouth flora of cats and dogs. This patient did own a dog, which would frequently lick her legs. This case suggests that pet saliva can be a risk factor for recurrent cellulitis. Patients with KTS are encouraged to avoid exposure to household pet saliva, especially in areas of skin breakdown, which is associated with this syndrome.